Hi, my name is Allison Kilcoyne, and I'm the Vice President of Integration, Wellness, and Community Engagement for North Shore Community Health, which is a federally qualified health center north of Boston. And I'm also a family nurse practitioner and a longtime practitioner of SBIRT and in school-based health centers. So we're going to talk about workflow protocols, and we are going to be kind of delving into the weeds, but at the same time looking at the big picture. So sometimes it's a hard thing to balance, but what we're really asking our staff of school-based health centers, especially the primary care providers, is to think about systems and doing things differently than they've done them before. And so as many school-based health centers is going to be as many workflows that you're going to create. And it's also really the goal is to create the workflow, and then the harder part is managing the change of the staff to use the workflow. So we think about the definition of the workflow is a sequence of steps involving and moving a process from the beginning to the end. But I'd like to challenge people to think we work with people, not with processes, right? So we can have the greatest process on pretty paper, a wonderful workflow, but if we don't really look at the human behavior around it, it's really hard to implement. And so I like to go back to some leadership quotes that I've learned over the years, and this is from Simon Sinek. There are only two ways to influence human behavior. You can manipulate it or you can inspire it. And so he talks about starting with why. And I think we talk about why. Why are we doing SBIRT? That's the place to start when you begin to implement a workflow. So why do we do SBIRT in school-based health centers? Well, there's a lot of data that supports the earlier that we intervene. With children and adolescents using substances, the higher their risk, the earlier adolescents start using substances, the higher their risk is developing an addiction. We know that there is use. 10th graders found that while 82% saw a doctor in the past year, only about a half were asked about drinking, and a quarter of frequent drinkers were advised to quit. We know that students are more likely to access sensitive care, behavioral health in school-based health centers. So school-based health centers, we have the relationship with the youth to really intervene early and motivate behavior change. So I know we all believe in that. And when we're looking at SBIRT, the other thing that it's important is to look at screening all school-based health center patients for the risky behaviors that they have, not just some. And I would challenge people to think not just at an annual exam. I would challenge people to think about possibly implementing it at each intervention, or thinking outside the box and implementing a workflow for any time any new patient enters, whether it's for immunizations or if it's for a sports physical. And engaging a patient showing risky substance use behaviors in that short conversation, you're developing your relationship, and then it makes it easier to get buy-in for the student to be referred to treatment. So when we think about screening tools, the only thing I like to say from my experience with youth and some of the data that show youth prefer to take self-administered screening tools before seeing their healthcare provider, and you may get a different score if they write down or write down on a piece of paper or on a computer what their answers are, rather than looking at you in the eye for the first time and you asking the questions during the screening process. So when I kind of looked at all of this and so what is the workflow definition for SBIRT? So what we really want to do is organize the implementation in school-based health centers into a standardized process, right? Just as I said, it's specific to each school-based health center, and it's really a fluid document that can change. once you implement it, you may do a PDSA quality assurance cycle and say, this piece isn't working well, and then change the workflow. It's okay, right? We can change what we initially thought should be the process. Really important to share it with all members of the team and keep it in a place where everyone can see it, look at it, or access it. And again, going back to the why. Why do we want to write down a workflow? What's the purpose? I just have to hand a piece of paper to someone and they write it down. Well, if we don't write things down, sometimes it doesn't get done, right? And so what we found across the country and through all the years with this SBIRT collaborative is that when you take the time to write it down specifically and explicitly, it saves time and frustration in the long run, and helps really gear staff towards following through on the process so that things don't get missed. Because as we are all busy, we may forget pieces. And so who's involved in creating the workflow? One of the things I've learned the hard way in management is I may think I have the best plan, and then I tell people about the plan, and then they say, yeah, it's not going to work here. And so this really needs to be a collaboration and a team discussion. And because we are a specialty in a school-based health center, we may want to involve school partners on how are we going to do this. And we want to also engage the youth, right? Like, let's listen to the youth voice. Maybe they have a better idea on how the process would work in a specific school-based health center. It's a great way to engage a youth advisory council. But think about all the people that this may touch and engage them in the conversation in writing the workflow. And so, as we've said, it should be simple, and it should be unique to your school-based health center and your SBIRT implementation. So you can decide what it looks like. It is a physical thing, right? So a workflow is a physical piece of paper. So it can be a document with bullet points. It can be a fancy graphic organized flow chart. It could be a poster. It can be a quick cheat sheet. Again, accessible, simple, but explicit. So here's an example, bulleted list. You write it down, you share it. The patient enters a school-based health center. The medical assistant greets the patient, collects the vitals, does the craft in the PHQ-2 or whatever tools that you are using, then meets with the provider. The provider does the screening, shares with the results, does motivational interviewing. And so you just kind of keep going down. Who does what? Who does the next thing? This is something that we, in my EMR, we talk about a workflow where it looks at not only the tasks and the who is doing something, but what are the steps in the forms in the EMR that need to be opened, and then who does it, the front desk, the nurse practitioner, the MA. And so this may be helpful for some of you that use the electronic medical record in order to collect the data. Graphic organizers. This is fancy. It's fancy around, some of you may have these skills on graphic organizing, right? Like who does what? So you've got over on the left, the medical assistant, the provider, and then the manager. And then it talks about each different step that needs to happen in order for the workflow, how a person moves through the clinic. I do like to stop for a minute to talk about when you hand out a tool, and there's some people that may say, well, we can screen, and if it screens negative, then that's okay, and we just move on and get into the visit. I really think it's important as a clinical practice that if you screen it, it should be addressed during the visit in some way, whether that's by the provider, even the opportunity to say, to do a small moment of education on the car driving. Well, you're not driving in a car with anyone that's been using congratulations, good job. I do think it is important to recognize that you've done the screening tool and give a little bit of education around that, and not just something that you've checked a box and done. So one thing I like to think about when making a workflow is what happens. Let me visualize what happens from the moment that a student walks into the school-based health center. Who do they talk to? What do they do? What documents, other documents do they need to complete? How do they get those documents? Who hands them to them? Are they electronic? And how can you incorporate the SBIRT processes into your already set processes? And I'm a visual learner, and so thinking about how someone enters, what's the signage, what's the educational materials you have around. Then they go to the waiting room. How do they get to the waiting room? Do they have to check in with anyone? Who's handing them the registration forms and the SBIRT forms? How then is that person getting into the exam room and having the conversation with the provider? Is it with a medical provider? Is it with a behavioral health provider? Is it with a community health worker? Who are they talking to? And then how are they getting either back to class, or how is the referral being made? You know, really looking at it step by step in order to make it specific to your space. And make sure that there is team consensus on who is responsible for what and when. And so frequency of screenings. Are you going to screen every single visit? Are you going to screen only on certain visits? Are you going to screen with new patients and then one person a year, a semester, a month? And then when are they happening, and how are you ensuring follow-up? Really explicit on the team and having that written into the workflow. And as I said before, the integration, make sure that you can integrate SBIRT into other workflows that are already happening, and how to integrate the documentation into your electronic medical record, making that kind of easier to pull data, or even easier for the youth to fill out. And be patient. Again, we're working with humans, not with workflows. So welcome the pushback, ask curious questions, and really focus on the high quality care that you want to deliver, and how is that reflected within the workflow. And so good luck. I always like looking at some cartoons and to smile. So there we are. I'm happy to ask questions now. Feel free to email me at any time, and